Okay. Welcome to this inaugural series, Docs in Discussion, where we will watch a short documentary related to a political topic and discuss the movie and/or invite a speaker to lead a discussion about the film, their project, or topic. Today, we are watching Rovina's Choice, which highlights how U.S. policy affects people globally. And following the film, Dr. Stephen Sidney will share his how policy spurred him to do something locally. And without further ado, we're going to start the video, and feel free to stay on screen or off, and we will see you in about 20 minutes. So that'd be great. Thank you.
Ora da bau lloré, no de lloré buco. Goloida. Betta da na ge ngata da na ro, urutte da bara ne ga. Betta na gu. Ni ma le, ibi bra kona ngati gi da ke mai ge da. Bata ka ge baru ko baca pula. Lake ngama kai. Poko te manna ge tena sampai wanya te biaru. Ba ke tere ge ma ko. Anya te te ma ro kana. Wa go ku te to ke gen ti ko. Te da da na da ngare tu ni go ti ni. Mara ina ele. Ba da na ni te jeri. Ko de te. Gue percaya kalau jalan dari jalan di jalan. Agarrano, leno, quello lo le che vesano. Ma che ne capiti? Tutto quello, hasta que lo pongo con la ley de que puto le toca. De bala ti sindi mo fu, kano jana sementaro kun jana ma sen. Akal ma fe, alle jana le bakon. Nana kan begal galan ya kele mu debi ga yan tasun ya ba mu lo de. Neka de ta mori ci ba ta illa to ai ci apro lo le ta illa mi se lo bi ko bi re de re un ka geje ta kare ba ngai re ci ba ngolo to ma to mo re de
We have been shipping food from the United States to starving people around the world for almost 200 years until Donald Trump and the Republicans stopped those food deliveries.
This is one of the executive orders that President Trump signed literally in his first hours after being inaugurated. Dramatic changes are happening at USAID.
The Trump administration is continuing to dismantle the U.S. Agency for International Development.
USAID is the backbone of U.S. humanitarian assistance around the world, billions of dollars of foreign aid.
Shutting down the world's largest provider of food assistance.
All USAID overseas missions will be shut down.
With us now, the former head of global health at USAID under President Biden, Atul Gawande.
These are people shutting down an agency and having no clue the work that is being done. I'm a surgeon. I led global health at USAID, and I can tell you, people are being harmed as we speak.
You know, it's a wipeout. Trump is
unleashing chaos and destruction. It's grim. It's grim. And just showing the facts of what is going on, and as much as possible, the faces of it. And that's what I think we really have to do. The dropping of the bomb of the sudden cutoff of USAID funds has an immediate blast zone. The care being provided to refugees, the vulnerable, and the insecure. It's the first thing that might be harmed. I wanted to visit Kakuma because of the context. It's in Kenya, which is a growing economy and a vital partner to the United States. But the region around Kenya is a powder keg. On its border is South Sudan, for example, where there's political violence and instability. Kakuma has 300,000 refugees. It offers a safe haven. Kenya and USAID were working together to transition refugees out of dependency, and it had become a model for the rest of the world. I'm at a refugee camp on the South Sudan border. World Food Program has been cut off from USAID to the point that they're now only able to provide enough for one meal a day. USAID was also playing a critical role in helping support that refugee camp, keeping people healthy, fed, and so enabling stability in the region. After the foreign aid termination, visiting the clinic in the community would help me see what the actual impact has been.
We're going to have a walk through the hospital. Clinic 7 provides the highest level of care for all refugees. This is our triage area. So as you can see, it's usually quite chaotic. To run this whole operation, I only have 5 doctors.
5 doctors for 300,000 people, so 1 per 60,000.
We started to see the impact of the funding cuts quite early when we had the first wave of people being let go of. There was a lot of incredulity, like this can't be happening. This actually cannot be happening. It seemed unimaginable that the cuts would be as bad as they were and affect the sectors where life-saving activities were ongoing. Because malnutrition is such a huge problem in this population, there's a specific word for them, the stabilization center. This is baby York. This is a child who's been in and out of the hospital for the past 1 month, I would say.
She doesn't have as much wasting.
Yes, they are improving slowly.
Children with acute malnutrition lose their ability to fend off disease.
This is Sunday. The baby is being treated for pneumonia.
These are vulnerable children who aren't getting enough protein and calories to survive. I would expect this would be the most fragile population who would be harmed by aid cuts.
Yeah.
I see the admissions are up. Yeah. The World Food Program cuts has started in February. So it's 2 months of lack of food. Now we're starting to see the surge. That's true.
One of the cases I wanted to show you was actually of this baby. During Sunday, they were severely ill. So they had gone now into severe acute malnutrition. They had developed a diarrheal illness. This can directly be linked to the food aid cuts that have been happening. Nyaka da ta jenga ni ne. Aka da ni lo le bijeta. Kana le bijeta wa to ki ya lo ta mo to. Ijina na no. Kanya ga le to gu. Ni do ya ni mu ya ni na du. Ba lo ga le man na. Kani na ne ala da do. O ko na ngati. O ne o ko do ri ngati bu. O ka ga da. Em. Nga na ka ga le che ta na o ga da. Dende na je. Te da sande ko kanelo bula da. Kene te. Ero taro mirika. Doang ane. Bale da lang wai. Aja gono be bu rong ane de. Doang ane de mo do de bu ara de da lang. Ya da mo da mir de ba. Ka jani ma kono. Ugu je da ma ga ri ro da. Ya le je bra ite. Jarra buli te to ma la ma je. Na ri ni to. Maro ko ne bu mo ro ta ni. Ko je bu cha nya ko le mu ya.
Mama, habari. Sasa, habari.
I took care of Jane. She had a severe form of malnutrition.
Mama anaitwa nani?
Yeah.
Esther.
When Jane came to us, the organs were failing. The kidneys are failing. The liver functions.
Hebu finya hiyo nione.
And she had severe form of edema. The legs were swollen. The skin were peeling off. The integrity of the skin was lost. And that's dangerous because the skin was not able to protect Jane from infections. And we were seeing all of this with Jane because of malnutrition.
So this is Jane Sunday.
She's about 15 months old. We need to monitor such a patient very closely. If the skin is thin and weak and breaking off easily, they lose a lot of heat and they're not able to control their own temperature.
Yeah, so they become hypothermic.
They become hypothermic easily. And for caloric intake, we feed them every 2 to 3 hours. This is a difficult case for us. For a long time, we've not been seeing such cases.
Improve management of children with malnutrition had a huge impact on the populations in the camp. With funding, providing food rations, nutritional supplements, having a follow-up protocol, we have changed the trajectory for children with acute malnutrition.
20 years ago, in places like Hakama, children with severe malnutrition had a death rate of around 20%. That is now less than 1%. It's been a public health miracle.
But management of malnutrition is a system so fragile that one budget cut could make everything just fall apart.
Nyeri no mo to ye to ko. Cha de lo ngi. Ito ba ke lo ku ni che lo ko de ngi chen ga da ke ma ge re ta ni to lo ga ta no ko to ro che ka lo mo ni. Che de ba ta ri che ko lo tu ma to mo ra ke. Ni che no ko lo ko ke men. Ite ga ne nga ne mo ko de ko de ko. Ko ne cho pa na ke na no. Perante ne. Ko me de lo chu ni ga na ne de ga tu lo la che ta da mo ge. Cho ko da ni chi ma ge de che to. Na ne ga ku na.
Their home is 12 kilometers away. We require parents to stay with their children. By the time that Jen's mother took Jen home, there was only one nurse in the ward. With the funny cut, staffing was reduced, so the level of supervision was very minimal. And no one noticed when they left.
Kone chopa na kena perante ni bubu jadi tak tahu no. Ari ngati ke korup bela lari ni. Pe jeremy jeremy aja. Nana magi jeremy go juru ke cara cedo. Bukara da dagar lui jaga lui jaga ka. Pe jeremy. Lui jaga ko na gol. Lui jaga ko kada gani na jaga ko do. Ne ra gol daga to laga ni kiri gol. Jadi mana kuni rita gani rita kali ke wale langa kor. Leo ku ngadu akan ngati. Nada ku ya dum kiri ni pe kimo. Ite o que na galo le beto agira. Toda lo yero ni tiki chaga meke. Ami. Pero que ta kutu guza gal. Ni pero kanu buru wana korto kunja. Zene ruido. No vale de dago kana boga gata le de uru gitu. Ida na ke jaramada. Rui. O do na nya de nugu tugu jana de na ngate. Uru richa kote nugu. Baga ni. O do na nya de nugu tugu jana de na ngate. Adan. Ubu no.
Can you tell me what happened?
Orang barat dakas. Banaka. Abi na kabigo nito. Nagine. Nagitiko ya naga jena. Nagu dua sei sande. Dua nada. Wasu lunas bonus ugale. Malta jubu jana de sebe. Kande zuru pele tabam. Be kalam janta sekaman. They are okay. Yao best has to be there for it.
How did it get so bad that a mother had to make such a hard decision? Take baby Jane with me so that I can go look for food for these other children. Otherwise, they will also starve. And that is a decision that no mother should ever have to make.
Malnutrition deaths. We've shown that they don't need to happen. We've found the formula and we've delivered it, and then we took it away. Then there is the blast radius still to come, like declines in vaccination and loss of control of HIV and TB that are going to be harder to see and affect hundreds of thousands to millions more.
I don't do wrestling.
We're going to continue to do food aid. We're going to do more food aid than any country on the planet times 10.
The issue here is we have children who are dying. So will you commit to continuing to fund the production, transportation, and distribution of life-saving products to save starving children around the world?
No children are dying on my watch.
Joining us now from Nairobi, Kenya, is Dr. Atul Gawande. Please just let us know what you've been finding there.
Secretary Rubio testified that the aid is continuing, that 85% of HIV funding is moving, and it's just not true. What we're seeing is real. Children in one refugee camp, they're seeing deaths per month this month that are higher than any other month last year.
The impact of the Trump administration's cuts to the U.S. Agency for International Development are being felt around the world.
Chilling warning from several medical researchers. A new study in the medical journal, The Lancet, estimates that funding cuts could result in millions of additional deaths in the next 5 years.
Researchers also say millions will die if the White House doesn't restore funding.
Okay. Oh, there we go. Hello, and we're back. I watched that video a few times just to make sure I was getting all the little parts of it, and it's powerful each time I've watched it. So, okay. Now we turn our attention to Dr. Stephen Sidney, and I have lots of feelings and thoughts. I want to maybe think about why you popped up in my head to invite you to today, but I feel maybe you could introduce yourself and let us know what you did, and maybe we can tie in how the movie and the documentary topics tie into what you accomplished here in Piedmont.
Sure. Thank you very much, Lisa, and thank you for the invitation. It certainly is a very powerful movie, and the topic of the movie and what I did are very connected to this whole issue of childhood hunger. So I've prepared a few remarks about kind of a little bit about who I am, about the problem, about why and how I reacted to the problem. And I will get into that right now. So I'm a retired physician epidemiologist who spent most of my career at Kaiser Permanente, Northern California Division of Research, which until recently was located in Oakland. Let me just ask, can you hear me? Okay. Okay. My family has lived in Piedmont since 1983. I've been involved in many volunteer activities during that time, both locally and nationally. Examples include 12 years of membership and 6 years as chair of the Alameda County Public Health Commission, assistant coach for the Piedmont High School cross-country team, and nationally, I'm currently the chief scientific advisor to the National Forum for Heart Disease and Stroke Prevention and Advocacy organization. Childhood hunger is a huge and preventable problem in the United States and around the world. In the US, 20% of all children do not know where their next meal will come from. Globally, more than 3 million children die from hunger each year. These are not just numbers, they are lives made miserable or lost to preventable tragedy. I was moved to act to do something about this problem when early last year, our country's leadership made drastic cuts to the federal food assistance program and close the United States Agency for International Development. Both the closure of USAID and reductions to the Supplemental Nutrition Assistance Program, shortened by SNAP, have left millions of children in the US and around the world more vulnerable to hunger and malnutrition. But what to do? I drew on a past experience. I am a lifelong runner who competed on my high school and college cross-country and track teams and ran about a dozen marathons. From my mid-50s to early 60s, I ran each year the number of laps around Whitterfield track corresponding to my age and years on a date that was somewhat close to my birthday. As I was preparing for my 59-lap run in 2008, the 10-year-old son of a project manager at my department in Kaiser Permanente was shot in the spine while taking a piano lesson at the building on the corner of Pleasant Valley and Piedmont Avenues from the bullet of a gunshot from across the street at the Chevron station, and he was paralyzed in both legs. I turned my run into a fundraiser for the family with a suggested donation of 59 times any denomination of money. The fundraiser raised more than $13,000 for the family. So I used that model for the new fundraiser, in which I would do 76 laps or 19 miles, one for each lap of my current age. I wanted the funds to raise awareness of the problem of childhood hunger, and the funds generated by the run to support a charity that provides food aid to children both domestically and internationally. I approached Feed the Children, a well-established, highly rated 501c3 organization that provides food aid internationally, currently to 8 countries in 3 continents, and domestically to 41 states. They were enthusiastic about the idea and provided me with a website in which the donations could be tracked. The other challenge for me was a combination of 2 physical problems which slowed me down immensely: neuropathy of my lower legs and feet, and a heart valve disorder. I knew my run would be very slow and prepared for it by doing progressively longer workouts on the track, with long runs every 2 to 3 weeks, starting at 30 laps, which is 7.5 miles, and adding 6 laps every 2 to 3 weeks until I reached 72 laps or 18 miles a few weeks before the event. I broke the 76 laps into 10-lap segments and completed it in just under 6 hours, of which a little under 5 hours was actual running time. I want to share with you a picture of the finish in which people who are running or otherwise hanging around the track join me for the final lap. And let me see if I can pull this up here. Okay, you're seeing that? Yeah. So that's obviously me on the left in front there. And, a whole bunch of very nice people, some of which who I've done a lot of running with, joining me. And let me pull that back down now, if I can. Okay, there we go. The $11.4 thousand I have currently raised will pay for more than 19,000 meals. A drop in the bucket relative to the need, but an effort that made me feel that I had done something positive for the problem, and also gave the people who donated a good feeling. So that's basically what my effort was about and how it came to be. And thank you.
Thank you. You're an inspiration, Dr. Sidney.
Thank you.
I was immediately I saw how the origin story how I came to invite you is I as League of Women Voters I was watching the city council meeting and you came in and introduced your effort and I for the first time ever decided to run in the turkey trot and I saw you there and I thought I had just seen this I was developing this docs and discussions and Rovina's choice was one of the top that I wanted to start it off with, and it immediately connected to what you were doing. And I thank you so much for coming and sharing your story, and it's really inspiring. And do you have any questions, Jennifer? Do you have any questions or comments?
Yeah, I was really inspired. Thank you so much. I see you running around Piedmont. I live on Highland Avenue, so
Oh, okay.
it's fun
Yeah,
to
right.
connect a face to a person and to a mission in a way. Um, yeah, I was curious, like what made you pick Feed the Children? I used to work for an NGO, Village Enterprise, that works in Kenya, and there's a lot of good groups. And now that USAID is out, a lot of them are trying to form more partnerships because of that whole. Um, so I was curious what your connection was, or if you did some research or you knew about them beforehand.
No, I actually, I didn't want to spend a huge amount of time trying to figure that out. I didn't have a committee helping me out with it. Um, I basically, there's a website called Charity Navigator. I don't know if you're familiar. Yeah. So I was looking on Charity Navigator. I actually first approached Save the Children, which, advertises a lot. And I connected with somebody at a lower level there, and they were supposed to call me back, and they never did. So I moved on to Feed the Children, and I got a call back from the guy who's really in charge of the fundraising effort pretty quickly, and he loved the idea, and so I went forward with that. I mean, there's a bunch of others. My um, son, whose youngest son, who's very political, was gosh, I'm forgetting it. The World Kitchen that provides, for Palestine. He said, "Why don't you do that one?" And
WTC, right?
yeah,
World,
yeah,
right,
yeah,
WTC.
right. And my feeling, the one feeling I had at the beginning, I wanted something, an organization that addressed the problem both internationally and domestically. And that was one of my background criteria for it.
I have a question about if you maybe how the policies are affecting are we getting accurate tracking how it's affecting in the United States or even globally at this point, or is it all kind of getting, because the agencies are getting shut down, so there's no way to kind of keep track of what's really going
Yeah.
on?
I actually do not know. It would not surprise me. I've done, some of my research really involved going to government databases and data sets, and I would imagine um, I would think there might be something like that, for example, for SNAP, but I have not looked into that at all.
And I think you have such a great point about what it does for the donors and also for the people who ran with you. It gives them a sense of agency. Because I think right now, a lot of people feel like, what can we do? It's such a big problem. And especially some of these numbers are so big that it's easy for this numbness to descend. I used to be in development at this group that works in East Africa, and we tried to put a face on it so that people could say, okay, we're kind of wired as humans, right, to think about individuals and not 8 million or 50 million or 2 billion. And so I really like the way that the movie focused on this one family, but this is a situation that's repeating itself every day in so many countries. And it was very dramatic, that choice that she had to make.
Oh, yeah, that's certainly horrible. as I said, nobody should have to make that choice.
It made me think too that she is probably suffering of some level of malnutrition as well. And how do you even make like a conscious decision? Like she could have just left her and just, left without her, but to not, knowing it's damned if I do and damned if I don't,
Yeah.
it seemed like there was really.
I mean, you have to think that she's, probably depressed, and there's a lot of depression related to this. I mean, how can you?
Trauma.
It's hard to keep your head up when something like impacting your children like that.
Yeah. And to imagine something like that could be happening here as well, where people don't really know or they live far away. Not all kids go to school or are part of things that are, that people see too. So I think it just speaks to the fact that we have to live with our choices, right? On some level, even national
That's true. That is true. Yeah.
about these things.
I was just packing food up at the Alameda County Food Bank last Saturday with some folks from my church in Berkeley. And the statistic they gave is that in this county, Alameda County, 1 out of 4 people is food insecure. That's enormous,
That is, and that doesn't surprise me.
Yeah.
Yeah.
And it's all ages. It doesn't discriminate, just that. Yeah, it's very, very heavy to think about. And so are you doing anything more with this, Dr. Sidney? Or is this do you have any plans to do anything else, or is this this is the one
I haven't really thought about it. I'm kind of getting to the end of my body being a usable instrument for running. I mean, it's real.
Well, you might have to hop on the League of Women Voters circuit then.
I'm impressed.
Yeah. Now it's in different areas. I've been working in my brain at least, and I've had a draft of an op-ed that I'd like to finish up and publish that relating to a different topic, but it's the Project 2025. I've actually looked at their book. It's a 900-page volume called Mandate for Leadership, and there's a chapter on every executive department, including Health and Human Services. And it starts out with a paragraph that kind of frames the whole chapter, which is full of BS, basically, factual BS, and basically accusing the fact that the Biden administration stated in the strategic plan for HSS that they developed that they wanted to put some emphasis on underserved, basically, groups. The BS part of it was these people went on to say that life expectancy for white males, that was the only thing they pointed out once, went down by 7%, while COVID was declining during the Biden administration. And that's just, I don't know where they got that number. It's actually totally untrue. The biggest decline in the last 50 plus years was during the first year of COVID under Trump, when life expectancy went down by 2.3%, and roughly the same figure for white males, if you really thought that should be the emphasis of it anyhow. Then the first Biden year, it was less than 1% decline, and then it's went up since then. So it was based on like I said, I don't know where that figure comes from, but no, I don't think anybody's pointed that out. And I think it's really important because they then say these policies of Biden to, take care of the underserved are destroying, the health, at least of white males, probably everybody else, which is nonsense. Life expectancy went up during the Biden years. It went down during the Trump years.
Well, I know I'm Polynesian, and I spent a study that UCLA did that Native Hawaiian families lost more people per capita because of the intergenerational homes, and also they work in healthcare situations and facilities, and they were just, everybody was just getting sick and dying. And I know, like my family in Hawaii, they had that couldn't get into the hospitals because there were so few. If they got COVID or sick or something else, the hospitals are
Yeah.
just overrun.
Yeah. No, it's tragic. Yeah. And what's happening now is tragic.
Yeah.
With
Dr.
rural
Sidney,
hospitals.
oh, sorry, I
Yes.
was going to ask if there are groups of physicians. I have a bunch of doctors in my family, some from Kaiser. If there are groups of doctors who are mobilizing around some of these issues that you're addressing with this run. Just like there's Doctors Without Borders, in international places. Is that the main one, or are there ones here in the U.S.?
Well, I don't know what the focus. I haven't been involved for a whole long time, and I have sort of a lot but limited attention. And we have two adult children who live at home, who have some needs, and there's a lot going on. But there is an organization called Physicians for Social Responsibility, and I'm not sure what their current focus is. Years and years ago, it was nuclear bombs, but I know they've moved away from that. But occasionally I get communications from them, and I just couldn't tell you, but you could look that one up and you might find some of the stuff you're looking for.
Yeah. No, I'd like to keep these types of conversations going and keeping the topics above. So anyway, I don't want to keep both of you, but happy to keep the discussion going. Or if you have anything else you'd like to add, or any more questions, I feel just so thankful that you came and shared your time with us, Dr. Sidney.
It was my pleasure.
Yes.
Well, I can stay here if there's any more comments or questions. I'm happy to.
Yeah.
Just keep running. You are an inspiration.
Tell us where you were born. How much did you
My knees hurt just thinking about it, but good for you. That's great.
Yeah, well, it doesn't feel too much like running. It doesn't feel the way it used to. I mean, I'm literally, that run was, like I said, it's about 15, 16 minutes a mile. I used to be able to do that in under 6 minutes a mile on the way to a marathon. But, bodies, we get older, and unless we're exceedingly lucky, things happen to us.
Yes.
Sure, you're an inspiration to the community, for sure.
Oh, thank you.
And like you said, you right now you've been using your body as a tool, but there are other ways to use your expertise, your status, your organizational
Well, I do
skills,
think,
whatever.
I think that, and I mean, there's clearly a lot of people who do a lot of stuff in this community in particular to make the world a bit better. And I think we all have things that we can do. And in many cases, we have some expertise or abilities that allow for a unique, different kind of contribution.
I think that's what was also stood out for me, was that it was so, to me, I felt like you were being called to do it, almost like something inside you clicked. And Jennifer knows I kind of tend to operate that way as well. Just like, I have an idea, we're going to do this. Okay. And, some of them don't always work out, but I'm so glad that yours did. And I just want to applaud you for that. Thank you so much. And
Okay. Thanks again. I'm getting too many applauses today, but appreciate it.
well, we're gonna get plenty more, because I want to post this on the YouTube channel for the League of Women Voters and let people know about it. And I'm glad that we had this time to talk, and I just really appreciate you being my first guest on the Docs and Discussions with the League of Women Voters of Piedmont.
Well,
Once a
that's
month.
great.
Thank you.
I'm honored.
Yeah, thank you so much.
Thank you. So I'm going to go ahead and wrap it up. I'm going to stop the recording, I think.